I'd like to offer a number of suggestions, a number of tips when palpating a muscle that's deeper into the body. And we'll use Justin's left abdominal belly of psoas major as our example here. The first tip would be that if you need to access deeper into tissue, then you need the superficial tissue to be slackened. In the case of psoas major, I have a very large bolster underneath his knees, which puts his thighs into flexion, drops his pelvis into posterior tilt, slackens the inter-abdominal wall, so it's easier to access in deeper. The next tip is to go slowly. If I try to go deep into the tissue quickly, then the client is going to feel some discomfort and will push me back out. So we need to give the client time to allow for the intention of the pressure to access in deeper. When it's a muscle like the psoas major that's very deep, we might even do it in a succession of repetitions. In other words, instead of trying to reach all the way into the psoas major in one go, I might purposely only go a little bit, wait a bit, then go a little more, wait a bit, and then go even more. So I might do it in 2 or 3 or perhaps 4 repetitions. And certainly we always have to have the client relaxed, so they need to breathe with us. Putting that together with slow pressure and repetitions, Justin, take a deep breath in and let the breath all the way out. And as he breathes out, I breathe out with him and I sink part way. Now, Justin, take another breath in. I ease off a bit. Breathe out. I breathe out with him and I sink in even deeper. And Justin, take one more breath in. I ease off some. Breathe out and stay relaxed. I breathe out with him. And then I access in all the way to the muscle. One more tip about working deeper into a muscle here is if we have to lead with our fingertips, then our nails need to be extremely short so we don't cause any discomfort on the client's skin. I normally feel that you never want to palpate through clothing because it's one more layer that you have to try and feel through. But when I'm leading with fingertips toward a muscle, like psoas major or quadratus lumborum perhaps, then I actually prefer to have a thin layer, usually of thin cloth, like a thin t-shirt, and what Justin has here is perfect already. This blunts the nails, even if they're a bit longer, it will blunt them so it will be less uncomfortable or will not be uncomfortable at all. Take a breath in, Justin. And let it all the way out. And now I can sink in. So a number of tips when accessing palpation for deeper muscles. Make sure the superficial tissue is slackened. Sink in slowly. Perhaps go with a number of repetitions. Always have the client breathe with you, and as they breathe out and relax, you sink in. And if the palpation protocol requires leading with your fingertips, have a thin layer of usually cotton cloth between you and the client's skin.